Hi everyone, this is Dr. Hall. We're going to do the last section of lecture 24, which is part 2 on STIs. We've talked about the parasitic infections, bacterial infections, syphilis, gonorrhea, and chlamydia, and then we talked a little bit about epidemiology. And now we're just going to close this part of the discussion by talking a little bit about public health. So first of all, there are certain types of infections that by law must be reported to the State Department of Health. We usually report them locally to the county, and then the state gets that data from the counties. And so things like tuberculosis and whooping cough and Ebola, things that can potentially be very contagious and or can cause significant harm if they're undiagnosed or untreated, or if people who are contacts of the infected people aren't notified and tested and traced and monitored, right? So these are potentially serious diseases that are contagious, and so it is by law that we report cases of these to the health department. All of the bacterial STIs are what we would call reportable diseases. So syphilis, gonorrhea, and chlamydia, anytime someone tests positive for one of those infections, we notify the health department. Now, this is not to get people in trouble. This is not to get you on some blacklist that is held by the government, not at all. The reason for this is to allow our local health departments to do several things. They're actually there to help you. So first of all, they want to make sure that the patient has been appropriately treated. Now, at Student Health Services, we see a lot of STIs. We're pretty good about it. We do a lot of it. But if you're a pediatrician or if you primarily take care of elderly patients, you may not see these infections very often, and you might not be up on the latest recommendations for how they should be treated. So the health department is there as a safety net to make sure that the medical providers gave the appropriate treatment to the patient and gave the patient appropriate information. They also will help with notification of contacts. So once someone gets diagnosed with chlamydia, for example, we need to then identify the people that have been their sexual partners and then contact those people so that they can get tested and potentially treated. Oftentimes we'll treat while we're awaiting the test results because we don't want to accidentally miss out on an opportunity to get somebody treated. So oftentimes the patient themselves will make those phone calls, but that can be not easy to do. And so what the health department does is they say, hey, if you feel like you can go ahead and notify your contacts yourself, that is excellent and wonderful. But if you're feeling a little unsure, we're happy to do it for you. And what they'll do is they'll do it in an anonymous way. They will contact the person and say it's come to our attention that you may have been exposed to this particular infection during this generic period of time. Now, obviously, if the infected patient is the only person that person has been with over the past several months, they will figure it out, right? But in cases where they've had several partners, they may not know, right, who the health department is calling about, right? So it can be a nice anonymous way to make sure that we can help identify those contacts and get them the testing and treatment that they need. Also, those people who are contacts, they may not have health insurance, right? Or they might not have a regular doctor. So the health department can help get them in touch with or do themselves, depending on the health department, free testing and treatment. So again, they're just there to help and make sure that everybody gets the testing and treatment that they need. The health department will then also keep statistics on these infections, which is really important from a public health standpoint. It's really important for us to know what diseases are out there and at what levels, right? So in Dunn County, this is data that I've been collecting since I've been working here at Stout. So Dunn County actually puts this data together and publishes it every year. The 2019 data, just so you know, is a verbal report from the director of Dunn County Health Department, because they haven't published their official results yet. It takes them time to do the analysis. So what we can see is that chlamydia is far more commonly diagnosed than either of the other infections, right? Interestingly, 2012 was a low year, and it looks like 2019 is going to turn out to be a relatively low year in terms of number of chlamydia cases, which is interesting. And you can see that gonorrhea is much less common, right? So almost more than an order of magnitude less common. So we had a bit of a spike there in 2018. It was coming down in 2019. We certainly haven't seen a lot of gonorrhea at the health center this year. Syphilis, you can see, is even less common in our community. So very rare cases of syphilis crop up. So that can give you an idea that if you hear me talking about chlamydia a lot, there's a reason for that, right? Because most of these cases are in our age group. So 90% of all these cases in the county are in people ages 15 to 29. And a full half of all cases are in people aged 20 to 24. And it makes sense because those are people who aren't married yet, but they are often sexually active and they're having sex with other people that are in that same age group. So you get that reinforcement there and the prevalence goes up. So if we look at state data, again, we see that young adult age group, so late teens into the 20s, is the group that has the most of these bacterial STIs. And we can also see geographic differences as well. So in Dunn County, we seem to be faring a little bit better than Eau Claire County. But not as well as St. Croix County, right? So it's, in sparsely populated counties, there's a little bit more artifact. But you can also see that we kind of have some hot zones in our state. So Milwaukee is an area with very high rates of STIs, and then Menominee. So not our Menominee, but the other Menominee up here, which is an indigenous community that has very few resources. So it makes a difference, right? If you have a robust public health system and access to testing and treatment, or if you don't, it makes a big difference. So the last thing I want to talk about in regard to public health is something we've talked about several times this semester, which is screening tests, right? So you'll remember screening is testing people who don't have symptoms to see if they might have a certain disease or infection, right? So we talked about mammography as a screening test for breast cancer, and now we're going to talk about screening tests for STIs. So screening, right, means testing people who don't have any symptoms. We're hunting for asymptomatic infections. So this is a really important public health tool, right, because these are people who wouldn't otherwise get tested. And we want to find those cases and treat them and trace their contacts to try to decrease the overall morbidity, which is illness, in the population. And so we've talked about when screening is an effective use of healthcare resources in terms of dollars, equipment, and time, right? So where are we going to get the most bang for our buck? Where are we going to get the most result for our resources? Well, it's going to be when the condition is relatively common. So we've talked about if it's a needle in the haystack, it's not going to be effective to try to screen. So doing a screening program looking for chlamydia in nursing home residents is probably not going to be a good use of resources, right? It'd be better to focus on the college age crowd. When the condition has no symptoms, right? That's kind of almost by definition, right? That screening, because you're testing asymptomatic people, right? So we want to test people who aren't going to otherwise develop symptoms or something else that's going to make them say, I should go get tested. We want to have an accurate test. So you'll recall when we talked about syphilis, the test is okay. It's not awesome. The tests for gonorrhea and chlamydia are really good, right? So they're very accurate. We have few false positives, few false negatives. The condition is treatable or preferably curable, right? So what's the point of finding something if you can't do anything about it? So with the bacterial STIs, they are curable. So we're meeting a lot of these criteria for screening being an effective strategy. And then the last one is that significant harm can be avoided by finding things early when they're asymptomatic. So in the case of syphilis, we can certainly avoid significant harm with that illness because it can occasionally be fatal and it can be transmitted to a pregnant woman's fetus. With gonorrhea and chlamydia, they can go on to cause PID, which can be a serious infection, as well as infertility. So that is some significant harm that we could avoid. So our current screening guidelines for chlamydia and gonorrhea are that we do screen young people most of the time. So if we look at them kind of in more detail, so for female-bodied people, all women 25 and under who are having sex should be tested once a year. This infection is really common in that age group, right? As many as 6% have it. It doesn't cause symptoms. It can cause bad things over time. So we want to check them every year. In men who have sex with men, we want to check a urine test and a rectal swab, if appropriate, every 3 to 12 months, depending on how many partners they've had. In men who have sex with women, there's not a clear guideline. They kind of say, well, maybe. It depends on what your local prevalence is. So although we don't necessarily require male-bodied people to come into the health center and get these tests regularly, we are very happy to test people for chlamydia regularly because we diagnose a decent amount of it here, right? So we at Student Health Services do recommend that male-bodied people who are sexually active, who have sex with women, get tested once a year, more often if appropriate, depending on how many partners you've had. For gonorrhea, which is less common, right? So it's a less common problem, so the bar is a little bit higher. For female-bodied people, we're just going to check if they have new or multiple sex partners or other risk factors like really risky sexual behavior, sex for drugs or money, or sex while high, things that put them at increased risk. And so that'll again be a urine sample or a cervical or vaginal swab. For men who have sex with men, again, we're going to test them every 3 to 12 months, and we're going to check the urine, a rectal swab, and the throat, if appropriate, depending on behaviors. For men who have sex with women only, because this is less common, we don't tend to test very often for gonorrhea in that group, especially because if you have it in the urethra, it is most often symptomatic. So we test for gonorrhea much less frequently because it's less prevalent and because it's more likely to be symptomatic, and therefore you wouldn't need a screening test for it. So in summary, the end of our parasitic and bacterial infections lectures. So we've talked about trichomonas, pubic lice, and scabies. We've talked about how parasites can be transmitted with fomites, all of them, and that they're treated with prescription medications. The bacterial infections can be cured with antibiotics. They require direct contact, and you can get infected with them multiple times over the course of your life. Syphilis has a lot of historical importance and a recent resurgence, so we can't forget about it. Gonorrhea is less common than chlamydia because it usually causes symptoms unless it's a rectal infection. Gonorrhea causes many of the same symptoms that chlamydia can because it infects the same regions. The one difference being that gonorrhea can also infect the throat, whereas chlamydia does not like to infect the throat. Chlamydia is the most common and the most prevalent. It is a very successful bacterial infection because it is often asymptomatic, which facilitates its spread within the community. From an epidemiologic and public health perspective, incidence is how many positive tests we get during a certain time period, which is of course dependent on how many people are actually getting tested. Prevalence, however, is the percentage of people at any given time who have the illness. This is when we go out and we survey and we test a whole bunch of people to see who has it. We talked about how these infections get reported to the health department, the bacterial STIs do, and that the health department is not there to punish you or put your name on some horrible list. They're just there to help facilitate appropriate testing and treatment for the patient as well as for the patient's contacts. And then we talked about screening. So it depends on how likely the infection is in that person, right? So number of partners, their community prevalence based on their age, their gender of their sexual partners, other behaviors, or other groups that they might be a part of. So screening is highly recommended for chlamydia because it's so common and often asymptomatic, less commonly recommended for gonorrhea, and even less commonly recommended for syphilis because syphilis is even less prevalent and the test is not as accurate. So we don't routinely test for syphilis in very many patients at all. So our next lecture, lecture 25, we're going to start talking about the viral STIs.